Hi, welcome back. This is Dr. Ray Benedetto, and we're going to go ahead and dive right in with fibromyalgia success secret number 10. And what we're going to be talking about today is the brain function, how your brain is working. We've mentioned this previously many times in success secrets and on some videos and things that patients need to be assessed and treated two ways, both neurologically, meaning the brain, and metabolically. Brain function is extremely important in treating fibromyalgia. Your brain needs two things to survive: fuel and activation. Fuel comes in the form of glucose and oxygen, so blood sugar and oxygen. That's it. Those are the only two things the brain can use for energy. What we do in our office is we use exercise with oxygen therapy. We have addressed the glucose end of the equation in our previous success secret. Now we need to address the importance of oxygen. As you age, your ability to utilize oxygen decreases by about 1% each year after the age of 25. So if you're 50 years old, you've lost 25% of your ability to utilize oxygen that you're breathing in your body. This is a term called oxidative phosphorylation, okay, which is just a big fancy $3 word meaning that you're not using oxygen as well as you did when you were younger. So again, with our therapies in the office, this is why we utilize exercise with oxygen therapy, or EWOT, in our office. Now, secondly, there are neurotransmitters. Okay, and these are our brain's messengers. This is what are used with, the depression medications and things. There's one called serotonin, which most people are familiar with. It plays a major role in brain function. There's a place in your brain called the hypothalamus, and there's something called the periventricular nucleus. Okay, I know these are big fancy words, but it's critical that you know this if you're suffering from fibromyalgia symptoms. Okay, serotonin acts or works on that hypothalamic periventricular nucleus in the central nervous system. Okay, and if your central nervous system is not functioning optimally, you're going to suffer with things like pain and fatigue because there's going to be serotonin issues. Okay, please be aware of what's happening to your body, because once you start asking medical doctors, why am I taking all of these medications that I've been prescribed, they're going to look at you like you're crazy. They will tell you that you have some psychosomatic illness, which to them means it's all in your head and the only thing you need is an antidepressant, and I don't really know what else to do for you. Again, the biggest, and this is going to come back to things we've talked about in the past, the biggest influence on serotonin is blood sugar. That's why we addressed it so thoroughly back in fibromyalgia success secret number 9. If you're hypoglycemic or insulin resistant or diabetic, it's vitally important that we get the blood sugar under control. That's why it's so important to eat healthy. That's why it's important not to skip meals. Quit eating junk food. If you're happy feeling miserable all the time, then keep doing what you're doing. But if you really want to get better, you're gonna have to change your life. If you want the same results you've always got, then keep doing what you're doing. If you really want to get, don't call my office because we can't help you. If you really want to get better, you got to do the things that are going to get you better. Junk food is not in the equation. Every time you eat junk food, you're literally eating away at your body, making your fibromyalgia worse. Okay, by consuming poor food, you'll increase your symptoms. You'll be feeling tired and sluggish. You won't be able to lose weight. Insomnia, fatigue, the pain everywhere. You'll have difficult and infrequent bowel movements, and you'll be depressed all the time and lack the motivation and all kinds of headaches. Basically the way you feel now. So you suffer from things like brain fog and skin problems and mental sluggishness, anxiety, depression, all this stuff. And you have all of these symptoms because you have fibromyalgia, or you've been told you do, yet all your lab tests are normal in the eyes of your medical doctor. It just doesn't make sense, right? There's got to be something else out there. And remember, those labs need to be within an optimal or functional range. So if you're really looking for some solutions and you're ready to do something, we can probably help. So give us a call. Our office number is 610-974-9911. And we'll check you out, and we'll see. Hopefully we can help you. Until next time, I'm Dr. Benedetto, and take care.